and she just taught me about how to assess somebody, how to treat somebody, but then how that was impacting
How
me.
they felt. That's so unique about psychiatry and psychology. I have to say this. I want to just really emphasize this to the listeners because, again, I love the Bernie Siegel line. The Dr. Bernie Siegel, the famous author and Yale surgeon, he used to say, the doctors are the tourists, the patients are the native of the land because they live it. And what's really interesting, I'll never forget once. So I remember reading this. There was one of the medical schools, I think it was at UCLA or whatever, and they had the first year medical students. And what they did, this was so quite unique and important. Like right at the beginning of their careers, they had them, take them on the hospital ward, put away their white coats, had them put on patient gowns, and go into rooms, and they each assigned them a diagnosis. And
Hmm.
then these other residents or doctors would come in and examine them. And just for our listeners, you say, well, what the heck is that about? Well, like any of us, when we're all on that other side of the table, and you're the patient, boy, does it feel different, and boy, do you kind of understand what your needs are. Not just, of course, you want to get better, but how you're treated. Am I correct? And that's why I think. I mean, obviously, in medicine, it's hard. You can't really have somebody else's disease, but that kind of training is critically, I think, important to be.
Yeah.
Is it empathetic? Is the right word? I guess.
I think it's really, really important. I think it brought to light the fact that like I felt the same way that so many other people feel. Like I didn't think there was anything wrong with me, right? Like I didn't think I could benefit from therapy. I didn't think it would be helpful. And it was life changing and it was really amazing. And to be, a patient and to come in feeling uncomfortable or to have to cancel a session and be like,